Hi, Ali. I've already talked with you pretty extensively about your paper, having read it on Friday just before we left, and it doesn't look like you've added a whole lot of new stuff since then. So I want to try and make this quick as we go down through here. Your opening paragraph I thought was really solid when I saw it before, still is. Looking at your last couple of sentences right here, if you want to read along with me. Um, Whoops, I wanted to highlight before this. I'm sorry about that. The University of California, Los Angeles met this level of success when they did a study to see what the various possibilities that animal-assisted therapy can do for mental and physical health. They found that the mental health, having animals around, lessens anxiety and distracts the patient, which generally releases a sense of happiness in them. The patient also tends to be more relaxed and calm from simply petting the animal. Other non-formal studies that include animals being brought in to relieve stress in college classes and animals going to hospitals to help recovering patients heal faster and lessen their anxiety. Okay, this is actually a really nice set of paragraphs or sentences. Ugh. Because what you're doing is being rigorous. When you talk about non-formal studies and when you make the point that um, it's releasing happiness, this is not something that is easily measured. So by making the point of that these are largely anecdotal, that they are case studies, that there's not necessarily going to be a lot of data that gets associated with this, you're not making too broad of a statement, which makes it easy for somebody like me to read this and say, okay, I need to modify my expectations. It doesn't mean there's anything of value in this, but this paper is not necessarily going to tell me about a practice that needs to change the entire medical, our medical practices. Coming down through here, we get a little bit of a history um, about animals, their use, good. The use of dogs in particular, good. And that most hospitals in and around the country do some version of this, good. And again, here, I like where you're at. You're being rigorous with your language, and I think this is important. Out of all these traditional and non-traditional studies, therapy animals have been proven, quote unquote, to work. I think this is excellent. You're making the point that all of the anecdotal evidence seems to suggest that that the use of therapy animals in hospitals and to try to help patients who are recovering from surgeries or other conditions is good. Great. I like where your head's at so far. You're doing a nice job with this. Unfortunately, as you say right here, this can be expensive. The cost of the average therapy dog is around $10,000 by the time the dog is actually purchased, and then the training and feeding and housing which go into this. Good, which means that in some cases it is prohibitive. And then down here, again, you're rigorous. There's no easy solution to the multiple problems with therapy animals. However, there are several ways that it can be lessened. Great. I like where your head's at with this. Ali, in general, I think you've done a really nice job of setting yourself up to answer this final question. Do those studies meet the definition of success? Are the therapy animals successful? Great. You've done a nice job. You're rigorous here. Finish this off. You're definitely on the right track, and you'll have a really good paper when you're finished. Talk to you tomorrow.